Welcome and thank you for being here. Today's topic is an important one and we need your help to get this information into the hands of families and caregivers. I'm Kendra King-Bowes, a member of the Choctaw Nation of Oklahoma and the project manager for the Helping Native Babies Project. Today we're focusing on the evidence for helping babies sleep safely in American Indian and Alaska Native communities. Before we get started, I just want to go through a few housekeeping notes. The webinar is scheduled to last for 90 minutes, and the last portion will be a question and answer session. Feel free to pose questions in the chat box throughout the webinar as you think of them, and we'll get to those at the end. For now, feel free to drop us a line in the chat box. Let us know who you are, where you're from, and we'll take the information and questions as we go along for the session today. We've got a lot of information to cover, so we're going to dive right in. Next slide, please. So I'm pleased to be here today with our Helping Native Babies Project team members. We're from across the country and we've been working together over the years to collectively create resources to help with safe to sleep efforts in American Indian and Alaska Native communities. I've got Lee Henry Tanner here from the Portland area, Marie Zephyr from the Great Plains, Geraldine Simpkins from the Bemidji area, Kristen Helvey from Alaska, and Shira Rutman is in California and is our evaluation consultant. And you'll be hearing from each of them throughout our presentation today. Next slide, please. Next slide. So this is the first webinar in a series of 3 that we are hosting. We're going to be sharing safe infant sleep and how to really share information with American Indian Alaska Native communities. Our second webinar will be focusing on teaching safe infant sleep and giving some strategies and tips. We also, on our third webinar, will be sharing some of the tools and resources that are available for your use. So those are going to be happening in March and April, and we encourage you to attend. If you're not able to attend those, we will be recording them and having them available on our website, and we'll share that link at the end of our session today. Next slide. So for today's webinar, these are the objectives that we will be focusing on. We hope that by the end of this webinar, you'll be able to define sudden infant death syndrome, sudden unexpected infant death, and data specific to American Indian and Alaska Native communities. We'll also hope that you'll be able to identify barriers and challenges that contribute to higher rates of SIDS and SUID in Native communities. Also be able to recognize safe sleep risk factors and protective factors in Native communities. Understand historical context of American Indian and Alaska Native people in relation to safe infant sleep. And finally, be able to foster resiliency when promoting safe sleep practices. Next slide, please. And next slide. So the Safe to Sleep campaign, formerly known as the Back to Sleep campaign, was created by the Eunice Kennedy Shriver National Institute of Child Health and Human Development, part of the National Institutes of Health. And that was really a way to be able to bring attention to SIDS and to educate caregivers on ways to reduce the risk of SIDS and other sleep-related causes of infant death. It's based on recommendations of the American Academy of Pediatrics, the AAP, and their task force on SIDS, and really is a great way to collaborate with federal, national, and state partners to help spread safe sleep messages. Next slide, please. And then the Helping Native Babies Project is part of NICHD and is funded through there, and it's an educational campaign that focuses on SIDS and other sleep-related causes of infant death, with the focus on American Indian and Alaska Native communities. And it really started out focusing on the 5 northern tier IHS areas: Alaska, Billings, Bemidji, Great Plains, and Portland, where the SIDS rates were the highest at the start of this project, which was about 18 years ago. And really we're focused on tailoring those safe to sleep messages for Native communities. So that's really what we're going to be focusing throughout our webinar series, is how to tailor those messages and educate families and caregivers and in the best manner possible. Next slide, please. So who needs to know about safe infant sleep? As you'll see from our list here, everyone from parents, parents-to-be, foster parents, childcare providers, our healthcare providers, public health educators, community members, babysitters, you name it, just about everyone needs to know this information. So as you're listening to the information that we're sharing throughout the webinar, we hope that you'll keep that in mind and be thinking about how you can pass along the information. Next slide, please. So I'm going to pass it over to Shira Rutman, who's going to talk to us about SIDS and SUID data.
Hi, everyone. So nice to see all of your names. Thank you for sharing where you're coming from in the chat. So in this section, I'm going to share a definition of SIDS as well as SUID, and I'll highlight some data on SIDS among American Indian and Alaska Native communities. Next slide, please. So we want to start by sharing the broad category of sudden unexpected infant death, or SUID. SUID is the death of an infant younger than 1 year of age that occurs suddenly and unexpectedly, and this is an umbrella term that includes both known causes and unknown causes, some of which you can see on this slide here. Next slide, please. The causes of death under the SUID umbrella term are typically reported as one of 3 types that are categorized by the Centers for Disease Control and Prevention, as you see on this slide. This includes sudden infant death syndrome, or SIDS, which we commonly refer to. And this is the unexpected death of a seemingly healthy infant under 1 year of age that remains unexplained after an investigation, which includes an autopsy, a death scene examination, and reviewing the clinical history. The next category is unknown cause, and this is the sudden death of an infant under 1 year of age that cannot be explained because a thorough investigation was not conducted and the cause of death could not be determined. And the third category is accidental suffocation and strangulation in bed. And that involves mechanisms that lead to accidental suffocation, including suffocation by soft bedding, someone rolling on top of or against the infant while they're sleeping, an infant being wedged or trapped between 2 objects, such as a mattress and a wall or another piece of furniture, and strangulation when an infant's neck is tangled with the string or tie of a crib or bumper or a nearby curtain. Next slide, please. SUID is one of the top 5 causes of infant death in the United States. And in 2019, 3,400 infants died of SUID. So it's important for all parents and caregivers to be fully informed. And these deaths affect all populations, regardless of race or ethnicity, wealth, or education. But we also know that SUID rates are higher among certain populations and demographics. And many of the populations that experience higher rates of other health disparities also experience higher rates of SUID. Next slide, please. In fact, American Indian and Alaska Native people experience the highest rates of SUID compared to other races and ethnicities. Between 2014 and 2018, the data included in this slide, the rates of SUID for American Indian and Alaska Native infants were more than twice that for non-Hispanic white infants. And this has been a disparity that's persisted for a long time. We're all focused on better understanding the issues for families in practicing safe infant sleep and how we can best support them to change the story. Next slide, please. So it's worth pointing out that between 1994, when the NICHD Safe to Sleep campaign started, and in 2015, the overall SIDS rate in the United States dropped by more than 60%, and that's the purple line that you see going down there. Around the same time period, between 1992 to 2010, the rates of back sleeping more than doubled, and that's the red line that you see going up steeply. So we know that putting babies on their backs to sleep and following safe sleep recommendations does make a difference, and we're going to get more into that in just a bit. Next slide, please. This graph displays what's called the triple risk theory of SIDS, and researchers have used this to describe the combination of circumstances that are most likely to lead to a SIDS outcome, and I'll go over each of these. There have been some studies which have found a biological basis for SIDS among infants born with brainstem abnormalities and those who may have an unknown genetic mutation. These vulnerable infants may lack coordination of vital systems, breathing, blood pressure, temperature, reflexes, waking and sleeping. However, since these abnormalities can't be seen, healthcare providers, parents, and families don't necessarily know that an infant is vulnerable in these ways. The second risk in the model is a critical developmental period, and this involves the baby's age and growth. So during the first 6 months of life, babies develop the ability to self-regulate their bodies. During these phases, baby systems are often unstable. However, these two risks alone aren't likely to lead to SIDS. The third risk involves stressors in the baby's environment, and these are things that most babies can encounter and overcome, things like exposure to secondhand smoke, sleeping on their tummy, or an upper respiratory infection. And again, by themselves, these stressors aren't likely to lead to death. But if they are experienced by a vulnerable infant who is also in a critical developmental period, the outcome could be fatal. For example, let's say a baby has an unknown or undetected vulnerability, then as the baby goes through a critical developmental period, the body systems become unstable. And during this time, the baby is sleeping in a bed with a loose blanket that covers its nose and mouth, and baby has to then breathe in the air that it just breathed out, which is low in oxygen and high in carbon dioxide. So because of the first two risks, the infant may not be able to overcome this third risk, and that could be fatal. This model is helpful because it points out how important it is to support parents and caregivers to address the risks in the baby's environment, as those risks can be reduced. Next slide, please. Next, we want to share some of the insights that our team gathered from experts on safe infant sleep in Native communities. Next slide, please. I just want to point out and acknowledge that we have many people on this call who are all experts. Many of you have such vast experience and expertise on this topic as well. And we'll look forward to hearing from you on your reflections later. But I'll talk specifically about the experts that we had a chance to speak with this past year. So during July 2020 and May 2021, our team conducted key informant interviews with 16 individuals. These were program directors, healthcare and social service providers, health educators, and a spiritual elder working to address safe infant sleep in Native communities. And they were based at tribal organizations, at hospitals, the Indian Health Service or IHS, urban Indian health programs, and university and state-based agencies that are serving Native populations. These were located in 8 IHS regions. So we really captured a broad range of experiences and perspectives with this group of experts. There was so much rich and critically important insight shared with us in these interviews. And we are planning to do all we can to share these findings broadly with public health providers that are serving Native communities to make sure that the process that we engaged in and the stories that were shared with us are not extractive, but they actually serve the communities directly that we're speaking about. We presented our preliminary findings from this project at an Indigenous Child Health Conference in 2021, and we're going to be presenting again at the 2022 International Indigenous Women's Health Meeting in March. So if any of you will be there, I will see you online. And we're working on finalizing a report summarizing the data as well. So please keep your eyes out for that in your emails or online. We've also been incorporating these insights into our Healthy Native Babies project materials, including this webinar and others, and we'll continue to do that. Next slide, please. So while the experts that we interviewed were diverse, we heard actually very consistent themes from them, which really highlighted the systemic risk factors for SIDS in Native communities. They talked about how the history of colonization, ongoing oppression, and structural racism continue to impact communities' efforts to reduce SIDS risk. And my cherished colleague Lee is going to go more in depth on these concepts a bit more in our webinar as well. These experts also talked about the need for policies that address common persistent challenges, and we're going to talk about a couple of these next. We asked these experts for recommendations, and we heard a few key areas, such as the importance of early and ongoing education on SIDS risk reduction, especially by home visitors, as noted by by the interviewees, and to include all extended family in these educational opportunities as possible. They also recommended strengthening collaborations across providers and educators and building on cultural strengths such as traditional activities. And we'll share a bit more of their words shortly. Next slide, please. So we're going to share some highlights from these interviews. And first, I'll start by sharing some of the barriers and challenges that our experts identified for us. And then we'll talk about some of the strengths that they shared. Next slide, please. When we asked what makes it difficult for many Native families to practice safe infant sleep, one participant summarized the most common issues as follows. There are challenges in the built environment, living in multi-generational families, living in homes where there is substandard housing. Babies may not have a place to sleep safely, and parents may struggle with living with elders when they try to insist on or demand smoke-free environments. The experts we interviewed all underscored the need to address the root causes of SIDS risk factors experienced by Native communities. And this included taking a holistic approach to safe infant sleep by prioritizing funding for policy level interventions in addition to individual level approaches. We also heard that COVID-19 pandemic impact has really exacerbated the housing and healthcare challenges and barriers that we heard about for families. Next slide, please. So issues related to housing insecurity were commonly shared by our experts. And what they shared is also reflected in national and state level data on American Indian and Alaska Native populations. I'll share a little bit of that with you all now. So for example, Native people have the second highest rate of homelessness in the United States and experience higher rates of overcrowding and housing condition problems than other racial and ethnic groups. A 2019 study reported approximately 10% of mothers of American Indian and Alaska Native infants in California were homeless or did not have a regular place to sleep at night during their pregnancy. And this was nearly 3 times the rate for the state overall. In this group, more than 10% also reported having to move during their pregnancy due to problems paying the rent or mortgage. So we know that housing issues can impact SIDS in multiple ways. For example, a 2021 study conducted in 5 states reported that among American Indian and Alaska Native women, experiencing homelessness significantly increased the odds of prenatal alcohol use, which is also a risk factor for SIDS. Next slide, please. However, within the challenges shared by the experts we spoke with, overwhelmingly, the most common shared was the lack of money and space for a separate sleep surface. Here are a few quotes that highlight some of these issues. The first, one person said, "People are limited based on what they can afford." The next quote says, "There are people who are couch surfing." And the last quote here says, "It's a much harder conversation with families who don't have the spaces to reinforce safe sleep practices." Next slide, please. Another challenge that we heard related to housing insecurity was reflected in this quote, which I will read. "I think for the young parents, not having a home of their own, kind of going from home to home, whether it's the father's parents' home or the mother's parents' home, moving temporarily from one location to the other, I think that's part of why cribs are not being used, besides the financial factor." Next slide, please. The second most common challenge to safe infant sleep described in our interviews with experts was barriers to healthcare. One person shared that for some clinics in tribal areas, there is no in-house prenatal care or obstetrician, and that obstetricians can be a long distance from tribal areas. Case managers at Indian health clinics may not receive any communication from an obstetrician, which was explained by one key informant with the quote that I'll read now. "You may see one family medicine doctor who takes care of you before baby comes, another one who delivers you, and then me for pediatrics after baby arrives. It's not always a consistent message across everyone, and that can be confusing." Another issue within healthcare described by a few participants we spoke with was cultural insensitivity and racial incongruence between healthcare providers and patients. So healthcare providers and patients not being the same race, and leading to a lack of uptake of safe sleep recommendations. Next slide, please. One key informant talked about this aspect of their experience as a non-Native provider serving Native families as follows. They said, when it's coming from someone like me who is not Alaska Native, when I say, let's get a bassinet and put the baby there, it can be taken as me saying the cultural practice is inadequate. It can come across as me challenging generational ways. It can come across as a condescending and almost a form of cultural oppression. So the primary recommendation around this issue was cultural sensitivity training for healthcare and social service providers to help address the barriers that families experience as accessing health services and those who want to engage in traditional practices and struggle to do so. Part of this is education and understanding about the history of colonization in the United States and the ongoing impact on Native people, including infant outcomes like SUIDs. Next slide, please. Next, we want to share some of the traditional and cultural protective factors that were described in our interviews with the experts. Next slide, please. This slide shows some of the key themes that were brought up when we asked these experts about traditional and cultural practices to support safe infant sleep, and I'll share a little bit about each of these next. The first is the strength of the extended family. Next slide, please. The strength of the extended family was the most common response when we asked about traditional and cultural practices for safe infant sleep in Native communities. One of the experts shared this quote, which I'll read. Many family members take an active role in helping to raise these children. Really, the community helps raise them. This concept also encompasses other types of social support. A few of our experts talked about the opportunity for community events and support groups as ways to build on community strengths to protect infants. And one shared the following quote with us, which I'll read. When families are connected to community and to other people in the same phase of life that can support each other, those are places where safe sleep messaging and harm reduction could really be happening. Next slide, please. Another traditional strength to support safe infant sleep in Native communities, which was shared by our interviewed experts, was the traditional belief that children are sacred. And this slide includes a quote on this, which I'll read. We are raising the next generation of our tribe, of our clan, of our people. That value is inherent in traditional Native culture and may have been lost through colonization, through the impact of trauma on our communities. This generation of babies are the leaders of tomorrow and the keepers and the helpers for the elders that we so revere. That quote always gives me the chills. It's really beautiful. We're so lucky to have the gifts of these stories. Next slide, please. These experts also talked about how traditional practices and teachings can be opportunities to build on a strengths-based approach to education and to incorporate education about safe infant sleep. Some of the examples they shared were beading, baby wrapping, dancing, breastfeeding, powwows where star quilts are gifted, sacred tobacco, and traditionally living substance-free. We also asked about the use of cradle boards, and most of our experts shared that there was a high level of interest in and use of these traditional items. A cradle board, which you can see in this image, is a baby carrier to keep babies safe, secure, and comfortable, while at the same time allowing the mother's freedom to work and travel. They consist of a frame made of natural materials and are decorated with materials and in a style that varies from tribe to tribe and region. It's flexible in use, decorative, and protective. We also want to point out that cradle boards should not be used in lieu of car seats. Next slide, please. The last thing we want to share from our interviewed experts on traditional and cultural protective factors for safe infant sleep is the diversity of practices and traditions across Native communities and within families. This can be from tribe to tribe, urban area to rural area, and in different families, some of whom are traditional and others that did not grow up with traditional teachings. This theme really highlights the importance of tailoring efforts to the communities and the individuals that are being served. And I'll read a quote on this. We have far more strengths in our communities, within our cultures, within our languages, and within our ceremonies. We have far more strengths than we have barriers or challenges. And to draw on those is really important, and connect those to whatever we are trying to affect change in is really important. I am happy to pass it over to my colleague, Geraldine. Thank you.
Thank you, Shira, and hello, everyone. I am Geraldine Simpkins. I'm the Bemidji Area Consultant for the Healthy Native Babies Project, and I'm in snowy northern Michigan. I see from our chat room that several of you are from the Bemidji region of Wisconsin, Minnesota, and Michigan. So hello to all of you out there. So the next thing we're going to talk about is risk factors and protective factors. Next slide, please. So let's look at the risk spectrum for safe infant sleep. Risk reduction is a behavioral change concept. It is used in health situations to reduce adverse outcomes. Often when people feel there are only two options, to conform or not to conform to the best practices, or for whatever reasons, they're not able to completely implement recommendations, they just tune out the recommendations altogether. It's important to note for different people, some of the risks we talk about may be difficult to eliminate than others. For example, alcohol and tobacco can be difficult addictions to quit, especially if there are constant triggers in the home. Or bed sharing might feel like the only option in a tiny home where there's no room for a crib or where the parents can't afford one, as Shira talked about earlier. Or if there's violence in the home and one parent feels the need to have baby close to protect them, bed sharing may feel like a good choice. It's important to help parents and infant caregivers understand each risk so that they can learn to identify ways to reduce each risk, however their own circumstances may dictate. We recognize families will make choices about their unique situations and the risks that apply to them. The risk continuum, pictured on this screen, uses a visual aid to compare situations and behaviors that we know increase or decrease risk. It also allows us to consider things that may or may not have been studied yet, or things that are considered neutral risk. Our goal is to help individuals think about what they are able and willing to change in their own behaviors, which will result in reducing risks and increasing the chance of safer sleeping practices. Remember, fear, guilt, and shame do not work. We must approach our interactions with infant caregivers without judgment and with empathy for people's individual circumstances. Next slide, please. Donna, is there a way to get the video photo up or no? Okay, we'll just keep going here. We're going to consider risk factors and protective factors. Research has shown there are both risk factors and protective factors related to SIDS and other sleep-related causes of infant death. Risk factors are those features associated with increased risk for a particular outcome. For example, exposing a pregnant woman or a newborn baby to commercial tobacco smoke is known to be a risk factor for SIDS. There are also protective factors that are associated with decreasing risk for a particular outcome. For example, placing an infant to sleep on his or her back and breastfeeding are known to be protective factors. We'll talk through some of these in a little more detail in a few minutes. Next slide, please. Here are some protective factors. First of all, a person should maintain a healthy pregnancy by getting early and consistent prenatal care with a doctor or a midwife. And once the baby is born, here's some protective factors to use. Back to sleep every time, breastfeeding, room sharing, uncluttered sleep space, pacifier use, and regular checkups. The next speaker will talk more about safe sleep recommendations when we get to that section of this presentation. Next slide, please. Here are some examples of risk factors. A sleep position other than the baby's back, soft sleeping surfaces including couches, armchairs, and inflatable mattresses, loose fluffy bedding or any items in the area such as toys, pets, quilts, bed sharing with adults or other siblings, alcohol use during pregnancy and after the baby is born, commercial tobacco use during pregnancy and in the baby's environment after the birth, overheating the baby with too many layers of clothing, and pregnancy-related factors such as preterm birth. Next slide, please. We want to highlight a common area of concern. It's about babies choking if they're on their stomachs. The number of choking deaths in the United States has not increased since back sleeping recommendations began in the early 1990s. In fact, most of the few reported cases of fatal choking involved infants who were sleeping on their stomachs. And anatomy might explain why. When a baby is lying in the back sleeping position, the trachea, or the tube on the lungs, as you can see on this slide, lies on top of the esophagus, which leads to the stomach. Anything vomited from the stomach through the esophagus has to work against gravity to enter the trachea and cause choking. This is not likely to happen. But the opposite can happen when the baby is lying in the stomach sleeping position. Vomit or fluids will exit the esophagus and pool at the opening for the trachea, making choking more likely. Remember, deadly incidents of choking are rare. Next slide, please. This slide is a visual example of a safe sleep environment. Risk reduction means providing parents and infant caregivers with knowledge so that they can make informed decisions. Remember, most parents want to keep their babies safe. Once they realize to make informed choices that can reduce the risk of SIDS and other sleep-related causes of infant death, they will most likely make the effort to avoid certain behaviors and embrace others. The behaviors we encourage them to avoid are the ones that increase risk. The behaviors we encourage them to embrace are the ones that decrease risk. Graphic depictions like the one of this slide can help infant caregivers understand the difference in their choices. Next slide, please. So what can infant caregivers do to reduce risks? Currently, there is no known way to completely prevent SIDS, but there are ways to reduce the risks. The good news is if caregivers reduce or eliminate the external stressors, which is one of the risk categories of the triple risk theory that Shira reviewed earlier, the likelihood of SIDS and other sleep-related causes of infant death is also greatly reduced. Teaching parents to eliminate outside stressors that we've talked about earlier, such as exposure to commercial tobacco, alcohol, and other substances, soft, cushiony sleep surfaces, soft bedding, bed sharing, and overheating, is one of the most effective ways we can support parents and caregivers in their quest to reduce risks as best they can. Remember, knowledge and practice are the key to reducing the baby's risk. Next slide, please. So here's a childcare problem-solving scenario for you to ponder. Please give your input either via chat or the audio. And I'm going to read what's on the screen here, describing this scenario. You are the friend of a young woman who has a 3-month-old baby. Her maternity leave is ending and she needs to return to work, so the baby will be going to a local daycare facility. You know that this mom has been willing to do whatever is necessary to provide a safe sleep environment for her baby. And you know that this baby always sleeps on his back at home. What could you suggest to help make her make an informed choice about which childcare facility might be best for her baby in terms of a safe sleep environment? And again, please give your input either via chat or audio. Any ideas?
Well, she could go ahead and go to the different facilities and see if they also practice putting the babies on their back.
Great idea. Thank you.
And then she also needs to find out from them how or everybody that is working at that daycare, are they trained in safety, overall safety?
That's exactly right. Thank you for that. What else? Like, what specific questions might she ask at the daycare provider she interviews?
Well, she would ask the position that they put the babies in, what kind of, what do they let them sleep with anything in the crib? The different risk factors and stuff is what they're going to be what she'll be looking for. So making sure the baby's not overheated, maybe give the baby a pacifier, those sort of things.
Exactly.
Another thing that I think also is important is what is the staff stroke infant ratio?
Indeed. Yes. What else?
What is their practice of swaddling?
Good one.
I think I would want
What other-
to have a facility that would be open to the understanding that this mom is struggling, you know, to make sure that baby's sleeping safe. Because I think a lot of providers sometimes will just say, well, we'll try what we can, and not make that mom feel very comfortable.
Yeah, that's exactly right. There are a number of people who are commenting via the chat too, so feel free to look at that. And I hear somebody else trying to make an audio comment. Please go ahead.
What is the record of the safety inspection of the sleeping areas and the cribs?
Perfect. And along with that, you might ask what the licensing requirement in her community is to address safe sleep guidelines. What else?
I would also want to know what their policies are if a baby falls asleep, like in a jumper or some kind of swing. Do they let them sleep? Do they move them?
Yeah, that's a great one. The other question would be, do they put only one baby to sleep per crib, or do they sleep any children together? What else? I might ask, do they ever put their babies to sleep on the tummies? In what situations might they do that? Or do they ever use sideline positioners? Those tend to be some common behavioral practices, which of course are not the safest. Any other comments?
Trained in CPR for staff is really important as well for emergency.
That's a great, make sure that everyone who works there has CPR training and safe infant sleep training.
And also what the policy is as far as smoking, like do they allow their employees to smoke? And even if they smoke outside, like do they have provisions of making sure that, you know, they're covered and then they come in and wash, that sort of thing?
Great idea. Yes, exactly.
What are the guidelines on monitoring children as they're sleeping?
Oh, that's a good one. And who exactly is responsible for leaning in on children sleeping? These are all fabulous ideas. Any other comments?
I'd ask if they allow children to use if they can use their cradle boards.
Oh, good one. And I suppose that we would also ask in that case if the daycare providers are familiar with cradle boards and how they're used. What else? Anything? You're such an informed audience that I think you hit on just about everything that I could think of too. This scenario is taken from the Healthy Native Babies Facilitators Packet, which can be used for training session orientations. And at the end of this webinar, we'll tell you more about how you can acquire Healthy Native Babies project materials to use in your communities. Before I turn this over to the next speaker, are there any other comments that you would like to make?
I have a question. I was curious about why pacifiers are protective. I was kind of surprised to hear that. Do you know what the mechanism is for that?
Sure. The thought is that when the baby sucks, that it actually is stimulating the breathing centers in the brain. And so that sucking helps remind the baby to breathe, because little infants have, many other systems are immature when they're born, and they develop in the first several months of life into the first year. And so the pacifier encourages the baby to breathe normally.
Interesting. Thank you.
Can they have that pacifier in the crib though?
Yes, they can. However, when the pacifier falls out of the baby's mouth, which it will do naturally when it's done sucking, you don't have to, put it back in. That's a good question. Any other questions? All right. Well, thank you so much for participating in this discussion. You're a great audience. Next, I'd like to turn over our discussion to my colleague, Kristen.
Hi, thank you, Geraldine. Really great discussion, everyone. I'm Kristen Helvey. I'm at the Baskin from the Bristol Bay area of Alaska, and now live on Denina land outside of snowy Anchorage, Alaska. So it's great to be with you today. And we're going to actually talk a little bit about some of the questions that you brought up here in this section as well. Okay, next slide, please. As mentioned, there have been dramatic improvements in reducing baby deaths during sleep since the 1990s, when recommendations were introduced to place babies on their back for sleep. The problem is that since that initial drop in infant mortality, declines have slowed dramatically. So I want to take just a moment to reiterate that many of you on this call are care providers yourselves. Care providers and others who have regular interaction with the caregivers, the parents or caregivers of infants during pregnancy and after baby is born, have a really great opportunity to counsel the caregivers on safe sleep practices. Providers can help to deliver and to re-emphasize these messages that we're going to talk about today as a trusted source in that area. And this is really key to affecting behavior outcomes. Also really important is that they're in a position to understand the circumstances in which the families live. And again, that's important because, like already mentioned, if a recommendation cannot be fully implemented within the home, then ways in which risk can at least be reduced can then be discussed in that context. So let's go ahead and jump in. We're going to review the safe sleep recommendations of 2016 as outlined by the AAP. Next slide, please. The first protective factor is related to sleep position, and we've already talked about that a little bit here today. We walked through kind of the science, right, and the data behind this guidance, and for those reasons, the #1 recommendation is to always place baby on his or her back to sleep, and this is for both naps and nighttime. And this is recommended to do, it's recommended to do this until baby is 1 year old. Next slide, please. So baby should also sleep on a firm, flat surface. Ideally, this would be a crib or a pack and play, although there are some alternatives, and we'll talk about that, discuss that in a few minutes. The sleep surface should have snugly fitted sheets, or a snugly fitted sheet with no loose bedding. And this includes nap time, when it may feel more convenient just to lie the baby down on the couch or the chair, right, in the common area. Unfortunately, soft sleep surfaces, while they're really cozy for us as adults, put baby at a much higher risk. Traditional infant sleep practices, such as the use of cradle boards, are also highly protective. Many tribes and urban Indian community centers now offer classes on making and using cradle boards, and this provides a really great opportunity to deliver safe sleep education and social support as well. So as you can see, baby's sleep surface is really important. Next slide, please. AAP further recommends to keep baby's sleep area clear of any objects. Now, this includes more obvious things like toys or pets, but it also includes things like stuffed animals or crib bumpers, loose blankets, things like that, as any or all of these items increase the risk of suffocation, trapping baby in an undesirable position, and or strangling baby. So the best practice is to have only baby in the sleep space. You'll see that one exception to that rule is the pacifier, and we'll talk about that here in just a little bit. Next slide, please. Room sharing is when a baby sleeps in the same room, but on a separate sleep surface as the parent or the sibling or another caregiver. Room sharing is a really great way to keep baby close, but still avoid the suffocation, entrapment, strangulation risk, or reduce that risk that is present when an infant is sleeping in an adult's or a sibling's bed. So share your room with your baby, but make sure that the baby is in a separate sleep space, one that is safe for infants, at least for the first 6 months, and ideally, again, for the baby's first year. Next slide, please. Okay, so we're going to look at this scenario, and again, similar to the scenario that we did with Geraldine just a little bit ago. Go ahead and feel free, I'll read this out loud, and then I'd love to hear from you in terms of how you would handle this or what advice you might have, and feel free to talk audio or put it into the chat. So this says, you are the supervisor of a community health visitor service. Your agency has made reducing the SIDS rate a priority. So you introduced materials from the Healthy Native Baby Project to your staff in the past. And one of your employees has said that she does not believe that babies should ever sleep in adult beds, no matter what. Now, she's still, as an employee, responsible to provide risk reduction information to families that she visits, including information on how to reduce the risk of SIDS and other sleep-related causes of infant death. How could you help her to address this personal challenge? Any ideas? Any thoughts?
I am really hoping that this individual has had some education in cultural competency, and they are culturally competent to work with every culture, every race, every background. I'm hoping. And then the first thing I'm gonna tell her is just to, first of all, establish relationship with the family. That is so important, because without establishing a relationship with the family, it's really very difficult to work with them. Mm-hmm. And also the first thing she needs to do, get to know what is their strength. What strength do they have currently? And then build on that strength.
Great. Thank you. Great feedback. Absolutely. What are some other thoughts? What are some things that you could talk through with this employee to help kind of close that gap for her? Any other thoughts? Ask her about her beliefs, it says in the chat. Yeah, get her to talk through that a little bit so you can have a conversation. Okay.
support the way that she is thinking about it and make an effort to then persuade her to understand on a broader perspective that, you know, you're providing this information to a diverse group of individuals that have different beliefs and practices, and how important it is to understand that.
Great. Yeah, thank you. Let's see, Cheryl says pros and cons in the chat. Okay. I don't want to overlook anyone. Did I miss anyone? Oh, in the chat, it talks about options like an empty drawer or a laundry basket. And yes, we're going to actually talk about that here in a moment as well. Sometimes it's a choice between the relationship and being right. Okay. Great.
Maybe we nurses are so, you know, we are so paternalistic that we go in, we're as an expert, as the one with the degree, you know, we go in with that notion, but we need to know that adapting to challenges of life and listening to our parents about what they said is their challenges and helping them to overcome those challenges is key, and working with them in partnership instead of going into that home with the notion of expert and, you know. So that is so important to go in with that belief of, okay, you, the parents, are the experts. I'm here to support you.
Great. Yes. Thank you.
Well, and I think also to piggyback on that is like support and then educate, because that parent may not know that there are alternatives that they can use to keep the baby safer.
Right, exactly. That risk reduction piece is really important, right? You guys have really done a great job, I think, touching on sort of our key messages here, which is the fact that families are going to make their own choices, right? So it's this employee's job to make sure that families have the best information, they have access to that information so that they can make their informed choices. And this includes the risks associated with bed sharing, and then also how to possibly reduce those risks, right? There are many reasons why parents choose to sleep with their babies. For example, like we've already discussed, not all families have access to cribs. If she is kind of all or nothing, right, in her conversations with these families, or not willing to have conversations with these families about these issues, then she's likely going to lose the attention of that audience, right? She'll be less effective in creating and maintaining a behavior change because of that inflexibility. So the risk reduction model is really important. We have all these recommendations, but we understand that people have different life circumstances and different reasons for making choices that they make. So presenting the information, very important, but also being prepared to talk about with families, okay, maybe you can't do this, but what can we do to reduce the risk wherever possible, and wherever their willingness is. Okay, great, thank you. Next slide, please. So it's really important to think about options for the safest possible sleep space, right? Parents and caregivers can provide an alternate sleep space for their, or sleep surface for their babies at little to no cost. And this came up in the chat a little bit ago. For example, a laundry basket, something like a wash tub, those can serve as alternate sleep spaces if they're put together well, and if they're not covered with unsafe bedding. A cardboard box, a dresser drawer, and then of course, cradle boards can also serve as safe spaces when at home or when traveling. Note that it is important to understand there's no data that exists on the safety of these items. So they're not recommended as ideal sleeping spaces, but they may be safer than the bed sharing alternative when no crib is available for use. Now, parents and caregivers also have to be really careful using items like these that you see on the screen because they may be prone to tipping over, especially as the baby grows bigger and stronger. They don't provide protection from pets or from siblings. And if left on the floor, people can trip over the baby or drop things on the baby, right? Walking over the top of the baby. So again, just use with caution. Next slide, please. So we hear a lot about the numerous benefits of breastfeeding for both mother and baby related to many different topics, right? Breastfeeding is also a protective factor against SIDS. Now, it's important that caregivers be especially vigilant, though, about their wakefulness when they're feeding infants or on couches or armchairs. Sleeping on couches or armchairs creates a higher risk of infant death, including SIDS. And so we know that when you're feeding baby at night, especially, it's really easy to be tired and to doze off. And so caregivers who are breastfeeding or feeding baby at night have to be very careful about that. These guidelines describe that infants who are brought into the bed for feeding or comforting during the night should be returned to their sleep space when the parent or the caregiver is ready to return to sleep. Now, compared to other racial or ethnic groups, our Alaska Native and American Indian mothers have the second lowest rates of breastfeeding initiation. And then these rates go down even further at about 6 months. The good news is that many of our American Indian Alaska Native communities are encouraging the cultural role of breastfeeding and promoting policies to provide needed family support in hospitals and workplaces and communities. So that's been really encouraging to see. Next slide, please. So overheating is a SIDS risk, and to reduce this risk, baby should be kept from getting too hot during sleep. And so some tips for doing that are to dress baby in sleep clothing such as a wearable blanket, which is designed to keep him or her warm without the need to have loose blankets in the sleep area. Make sure that the baby is dressed for the environment and not over bundled. I know we often think, babies get way colder than us, and the best practice, the guidance is to dress baby in one layer more than you as an adult would be comfortable in that room or in that area. And then keeping baby's face and head uncovered during sleep is, of course, very important as well. Next slide, please. Environment and lifestyle are topics that come up often when discussing the risks for many different health outcomes. And this is also true for SIDS and for sleep-related SUID. So both American Indian and Alaska Native men and women have the highest prevalence of smoking compared to any other population group in the US. And we know that tobacco companies continue to target American Indian and Alaska Native communities through extensive promotions and sponsorships and advertising campaigns. So this is a challenge that we really must continue to work to overcome. So the guidance here is to reduce the risk of SIDS. Don't smoke during pregnancy or allow smoking around your baby or in your baby's environment, and avoid smoking, drinking alcohol, using marijuana and illegal drugs during pregnancy and after baby is born. Next slide, please. Now this one is really interesting because there has been excellent marketing of commercial products to parents that claim to reduce the risk of SIDS, right? This product reduces the risk of SIDS. Most of these items, however, have not been tested for safety or effectiveness, and their claims are just marketing tactics. What's worse is some of these products can actually pose added danger to babies. So for example, the US Consumer and Product Safety Commission and the FDA issued a warning against the use of sleep positioners because they found that those products were actually unsafe for children. Some products are made out of foam, rubber, or memory foam type material, which claim to be good for infants. But unfortunately, they actually also put babies at risk of suffocation, and they should be completely avoided. Other companies sell things like home monitors that claim to detect SIDS and other life-threatening events. Research actually shows that these monitors are not effective at detecting or reducing SIDS at all. And in fact, they have often caused more and unnecessary stress and worry, and sometimes even over-medicalization. So we know that we live in a buyer beware world. We all know that. But these products are especially nerve-wracking because they really prey on parents' desire to do whatever possible to keep babies safe. Unfortunately, the products are often just creating a false sense of security and can actually impose more harm than safety. So these should be avoided. Next slide, please. AAP also recommends routine healthcare. So following your healthcare provider's guidance on babies' vaccines and regular health checkups and schedules. Not only do vaccines work to protect babies' health, but research shows that the vaccinated babies are at a lower risk for SIDS as well. And it's really important to note, as we brought up here several times, that culturally appropriate care and prenatal care is a critical piece to improve outcomes among American Indian and Alaska Native populations. And as you know, we've seen lots of examples of home visiting programs that have reported really successful outcomes among American Indian and Alaska Native communities. Okay, next slide, please. Okay, so we talked about this a little bit already, but pacifiers can help to reduce the risk of SIDS. And this is true for all babies, including breastfed babies. So you want to consider offering a pacifier at all sleep times, right? So naps and nighttime. It's recommended that you wait until, if a baby's breastfeeding, going to be breastfed, that you wait until breastfeeding is well established. So often by 3 or 4 weeks. Don't attach the pacifier to anything. And so this is where the exception to the rule is pacifiers are fine to be in the sleep space, but it's critical that they're not attached to a string. You know, sometimes you have them attached to clothes with a string. You want to make sure not to do that during sleep. Or don't attach to clothing or a stuffed toy or blankets, anything that carries risk for suffocation or choking or strangulation. And then the other piece is don't force the baby to use the pacifier. Oftentimes what happens is baby might start with pacifiers or a pacifier and it'll spit it out during sleep, and that's just fine. No need to try to put the pacifier back in. Okay, next slide, please. And then finally, you want to give baby plenty of tummy time. It's important to point out that tummy time should be supervised. Babies should never be left alone on their tummy. But this is really good for strengthening baby's neck and shoulders and arm muscles. And it also, as kind of bonus, helps to prevent the flat spots on the back of babies' heads, which sometimes parents can be concerned about. So with that, I believe there were quite a few questions in the chat there, and we can take a look at those real quickly. And if you have any other questions, please feel free to speak up or add them before we move on to our next section. Let's see. Scrolling down to the right questions here.
Hi, Kristen. One that I noticed, or a couple that people asked about, is the alternative sleep surfaces. How does that work, for that? So we just wanted to address that one. One of the things, like say if you've got a laundry basket that you want to use, one of the things that we recommend is you can cover a piece of thick cardboard with, say, a lightweight blanket or receiving blanket, something like that. Secure that blanket using masking tape or a safety pin, and then put that tape or pin down at the bottom of the laundry basket or the wash tub, whatever alternative surface you have. And then baby goes on top of that so-called mattress that we've put together. So that's one of the questions that looked like was in the chat box there.
Great, thank you. Kendra, we have a question about whether programs that are encouraging family education with mom. Do you have any information about that? Or I could open that up actually to anyone on the team here. Programs that offer or encourage family education with mom.
We use at the Oklahoma City Indian Clinic, we use Family Spirit, which was developed by Johns Hopkins and their Native American Education Department. So but we use that. And then, of course, the Oklahoma State Department of Health is another one that they have safe sleep training as well. And so we have a home visitor program at our clinic. And so, but of course, with COVID, we've switched to a lot of virtual, but it's still getting the message out. So that's part of, we have 4 specific classes that they have to take. One of them is like on child safety, baby proofing your home, that sort of stuff. And that's included in it, the safe sleep. And if they take that class, then they get like the 4 classes, they get a car seat, and then with the safe sleep class, they get a pack and play. So it's worked out really well.
That's excellent. Thank you for that.
So I was the one that asked that question, and I asked because my mom was the one that encouraged the bed sharing when I was breastfeeding. And so as a young parent, of course, you're going to listen to what your mom's telling you, right? And that's why I wondered if programs encourage moms, dads, grandparents to get the education as well, so everybody's on the same page.
Right. Yeah. The family spirit is geared toward, of course, the patient, but it's encouraged to have as many family members as well. So we can educate as the whole group, a group, or just the individual. But that does come up a lot, that people's moms, it's like grandparents are tricky. So we're getting ready to try to do like a little YouTube video to show, especially like during Grandparents Week, that sort of thing, to show them some of the safe sleep practices, because some of them, like it's hard sometimes for the adult child, I guess, to actually go against what their parents are saying. And so like it's a nice way to kind of introduce it as this is what, the research shows. And it's not just it's not just they're trying to be rebellious or anything like that. So anyway, that's kind of what we're doing.
Thank you. I think that's a hugely important point about informing the family, and the Healthy Native Babies Project does have materials, and through our materials, we do encourage that sort of education for caregivers, but also sort of anyone, right, who is going to be sort of involved in that process. And so it's a really, really important point. I think it kind of varies project to project in terms of how much that is reinforced, but I agree it's critical and comes up often as well. I'm going to go ahead and, for time purposes, move us forward. If you have a question that we've not answered, please do drop that into the chat, and we can collect those and make sure that we follow up. I'm going to go ahead and turn it over. Next slide, please. Turn it over to Lee, who is going to talk us through some of the context in which our American Indian Alaska Native families live, and how this relates to safe sleep. Thank you.
Thanks, Kristen. Hello, everybody. I'm Lee Henry Tanner. I'm a transplanted Nez Perce tribal member from Idaho, now living in the homelands of the Suquamish people in Bremerton, Washington. And so first, I'm going to discuss some background on the context in which Native and Indigenous people live. Next slide, please. Historical trauma is the accumulative emotional and psychological pain over an individual's lifespan and across generations as the result of massive group trauma. This research is really important and was developed by Dr. Maria Yellowhorse Braveheart in 1995. Next slide, please. Traumatic experiences endured by Native peoples include widespread death through warfare and disease, food shortages and famine, erosion or loss of cultural traditions, loss of traditional languages, prohibition of religious practices, forced removal of children from their homes and placement into boarding schools, child welfare policies that broke bonds in many Indigenous families' lives, forced assimilation into the dominant culture, such as cutting hair in punishment for practicing cultural traditions and language, forced sterilization, lack of security through forced dependency on the federal government, overwhelming poverty, pervasive racism, race-based segregation, and acts of discrimination. Next slide, please. Race-based stress. So historical trauma often leads to increased risk factors for Native communities. Those behaviors include decreased self-esteem, increased anxiety, depression, and mental health disorders, and the decreased ability to keep self and others safe and healthy. Next slide, please. When working with American Indian Alaska Native families, it's important to realize that historical trauma has led to increased rates of SIDS and other sleep-related causes of infant death. It has also impacted people's ability to care for their children in traditional ways that have historically kept infants safe. Cultural factors that contribute to unintended infant injury and death include loss of traditions, traditional American Indian Alaska Native social networks, loss of protective cultural traditions, including child rearing practices, weakening of traditional family networks that shared responsibility for caring infants and mothers, loss of cultural etiquette that encouraged community child rearing. Health disparities can be attributed to increased rates of injury and death among Native families and communities. Next slide, please. Next, we'll be talking about fostering resilience. Next slide. Resilience is the capacity to recover quickly from difficulties. Resilience implies elasticity, the ability to spring back into shape after a challenging situation. There are several characteristics that foster resilience, and you can see them right here. Place of origin, cultural identity, traditional practices, ceremonies, community activities, kinship ties, and I think really important, humor. Humor has gotten our people through many, many challenges, and I think that's something that we really need to remember. Resilience is made up of 5 pillars: self-awareness, mindfulness, self-care, positive relationships, and finding purpose in life. By strengthening these pillars, we in turn become more resilient. Next slide, please. Resilience is a skill. It's an adaptive mode of thinking which has to be developed gradually, alongside techniques for improving one's initial response to something bad or unwanted. Next slide, please. Resilience is the result of a combination of protective factors that can be strengthened even under adverse circumstances. These protective factors can be strengthened by practicing certain behaviors. 3 protective factors that continuously appeared throughout research and correlate with resilience in adulthood are self-efficacy, social support, and physical health. It's all very important information to keep in mind as we're working with Native families. And now I'd like to pass this over to my colleague, Marie. Thank you.
Opilawi, and thank you for sharing that. Good afternoon, relatives. My name is Marie Zephyr, and I'm the Great Plains Area Consultant. I've had the privilege and honor of working for the Healthy Native Babies Project for the last couple of years. And I'm really excited to share some of these ideas for how to promote safe sleep practices in American Indian Alaska Native communities. Next slide, please. First, I kind of want to stress that these are some recommendations that we'd like to provide. Communication is enhanced through awareness. However, it's important to also recognize that American Indian and Alaska Native communities are very diverse within themselves. Not only do we have regional differences, but even within our constricted regions, there's variations in cultures. So always remember that you can't just blanket one culture across, just giving that as a disclaimer. So when communicating with the American Indian and Alaska Native people, we really encourage providers to introduce themselves and ask how their family is doing we're really relational people. Some people call it the eagle's view, where we see things all as connected, and just being interested in finding those relationships within yourself is definitely encouraged. You could also phrase questions that are culturally tailored. Ask your patients, maybe, are they comfortable answering your personal questions? Tell them that they don't have to if they don't want to, and also ask if they integrate any of their traditional methods into their care. Some things we found that often escape people who are not used to working in AI/AN communities is it is important to keep those considerations at the forefront of our minds. Sometimes they seem like common sense, but without reminders, it's easy to not think of them. So things, being cognizant of what those cultural considerations are. And many tribal persons don't like eye contact nor to be touched. One example of that, we have in the Lakota country, like a handshake is typically gentle, whereas westernized, a firm handshake is considered like a sealed deal. So there's a difference in variation in culture in itself for to keep in mind as well. Next slide, please. So as Shira mentioned earlier, these expert insights really gave us different perspectives. And actually this one is particularly related to the questions you guys had earlier, because it talks about generational perspectives and how they vary. In fact, I'm going to read how elders are very much respected in our culture. Even though we know safe sleep recommendations have changed over the years, grandma might still think that it's good to have babies sleep on their stomachs. And just as that key informant indicated, the rules have changed, but in a society where we're primarily matriarchal, meaning where women make a lot of the decisions, it's very important to go to that highest esteemed elder and make sure that they have the same information as their opinion really matters. Next slide, please. So in cultural preparedness, we really have to think about how we can respect customs specific to AI and AN communities. This is dependent on what's appropriate for your area. As I said before, we're diverse as nations. One thing, there are similarities though. A lot of AI/AN communities offer meal or foods, or even in the group activities, they prefer to have a meal, as it seems to be a customary thing. Many AI/AN prepare a spirit plate or lead a pre-meal blessing. It's also important to recognize that in tribal communities, there's different activities, such as tribal holidays. A lot of tribes will celebrate their specific histories, and for that, they delegate their tribal holidays. So that's something to think of. Also, another thing to consider is media and how it looks different for different subpopulations. This is another area that we can't blanket. Like, for example, you can't share news just only in a newspaper, because that will maybe potentially hit the elder population. However, it misses the youth and adolescents. Next slide, please. Next slide, please. Okay, and here's our discussion question. I just really wanted to ask and see if all of you thought that what communication strategies have been effective for you when you were working in AI/AN communities. I wanted to type the answers in the chat box if you guys have anything that I may not have covered. I know I really wanted to stress the importance of integrating grandparents, because it's like a community deal to raise children in AI/AN communities. Okay, well, if there aren't any questions, then I'm going to go ahead and hand it off back to Kendra. Thank you so much for coming.
Great, thanks, Marie. And we are nearing the end of our time today. Looks like we've got about 10 more minutes, but we wanted to open this up for questions and comments. I think we've had an opportunity, at least throughout a couple different sessions, to do that. And we've been trying to answer some of the questions that are coming in the chat. I think we have a couple more we still need to address, but would love to open it up for any other things that come to mind that you'd love to hear, or if you want to share any of the great work that you're doing and I think it would be helpful for others, we welcome to do that. So feel free to put that in the chat, or you can unmute and provide the audio as well. I did want to address, I saw one question that came in. So while you all are thinking about questions you have, I'll go ahead and address this. Let me see. Oh, we had the question about secondhand and thirdhand smoke and studies on that. So, secondhand smoke does compete with oxygen in the baby's lungs, resulting in increased risk for infant infections, asthma, and hospitalizations. And infants who died of SIDS had a higher concentration of nicotine in their lungs than did babies who died from other causes. There's also another study from NIH from a few years ago on second and third hand smoke exposure. There's not been a lot of studies out there, but it definitely shows that those are things to definitely, consider because especially infants, as they are getting around, crawling, putting things in their mouths, touching those things, they're starting to ingest smoke residue, or they get it on their skin. So that's definitely something to consider as well, that the second and third hand smoke exposure definitely need to be aware of for families that have smoking in the home. Hope that answers your question. If not, feel free to follow up. So any other questions you've got in the chat, feel free to go ahead and post those there and or open it up, unmute, and we'll take your audio questions as well. We might go ahead and if you will go to the next slide for us, Donna, please. While people are thinking about those, I want to go ahead and give a plug. As we mentioned at the top of the webinar, this is the first in our series of 3 webinars. Our next one is going to be March 16th, and we're going to focus on cultural considerations for safe infant sleep, working with Native communities. So we'll really kind of expand on some of the things we talked about today and really give you some great tools for when you're training, working with employees, working with your families and caregivers on how best to really handle some of those situations. And for those of you who maybe can't join on webinars or have others who you think would be interested in hearing some of the information, we do have a link at the bottom of the page. We'll be posting the recordings to those. This is also where we have our materials. I know we've mentioned throughout today, we've got a facilitator's packet. We've got some great handouts. What does a safe sleep environment look like? We've got a booklet as well that's great for families. So you can access that information there. Most of those materials are available for you can order free of charge. They will ship those to you. You can also download PDFs as well. So we encourage you to take advantage of that. Let's see. Oh, we also got a question about if we can share this PowerPoint with us. So yes, we can get that into a PDF and have that available and send out to those that have registered and attended. We will make sure and do that. Any other questions?
I do have a question. Did anyone talk about the homemade swings that we use in our communities over the years?
I don't think that we touched on that, but certainly would love to. We are aware that there's more than just the cradle boards, but if you want to talk a little bit about that, certainly go ahead.
Well, one of the practices that I experienced with my parents was they always had a homemade swing above their bed, and it was just 2 pieces of rope attached in the corner so that it made a triangle in the corner then. And they would put a stick on one end where it was open and a stick on the other end to keep it open. And then they would swaddle the baby, of course, and put them in on the back to sleep, and use a towel to just wrap them in like a safety harness. And the babies would sleep in there, just because we had a small home and very little space for a crib.
Great, appreciate you sharing that with us. It's always good to learn what is happening in the communities. One thing just to point out, we would want to be aware of concave sleep surfaces are generally not recommended by the AAP just because it can compromise baby's airway if their chin becomes pressed to their chest, leading to asphyxia. So that would be one thing to consider, for those that may be still using that type of sleep surface. Just want to take that into consideration. But thank you for sharing. Any other questions or comments? If not, we really appreciate you joining us today in our first webinar. And we want to thank you for all the great work that you're doing to help keep babies safe. So thanks for the work that you do. If you've got questions, feel free to follow up with us. We'll be happy to answer them, and we look forward to seeing you on our next webinar. Thanks and take care.